Okay, this is coming to you live from my house in Midtown on a very snowy day. So if you hear the screams of a child, it's because my son is stuck in this house with me too. So it's a little bit crazy here right now. So let's talk a little bit about anatomy of the abdomen. So we're just going to zoom in. We're about at the level of the hemidiaphragm here. And let me get my laser pointer. Okay, so first things first, what is this right here? It's the right ventricle. This is the left ventricle, and then we can see just a little bit this black line right here is the intraventricular septum, right? Left lung. Okay, and these guys right here are ribs. Okay, let's look. So right here is the esophagus, aorta. This right here is a vertebra. Okay, and if you can see that little guy right there, the hemizygous vein, and this one right here is the azygous vein. Right, then this big structure here is the liver. This gray area here between ribs, intercostal muscles. Okay, maybe we can see this faint little white line right here. That's a coronary vein. And all of these faint white lines within the liver, those are portal venous. They're branches of the portal vein. So over here we have kind of the left lobe. It'll be a little bit more apparent on another image. Let's actually go ahead and forward along to that image. Let's scan over here. We can see the liver a little bit more clearly now. So left lobe. This over here is the spleen. This right here is the stomach, and we can actually see barium in the stomach. Okay, this is the caudate lobe of the liver. And then the right lobe. This faint line right here is the diaphragm. We can also see diaphragm over here a little bit more clearly. This right here is the inferior vena cava. And then finally, these veins out here are hepatic veins. Alright, moving along, so we're a little bit more inferior. This black spot here is the falciform ligament. This irregular shaped structure here is both the left gastric artery and the left gastric vein. This little black spot here is air in the stomach. And then we have barium in the stomach there. This is the spleen. And then right here we can actually see the splenic artery. Okay. The left kidney. And then this irregular structure right here is the left adrenal. We can still see a little bit of the diaphragm right here. This is the dural sac and the spinal cord. This is the aorta. This is the inferior vena cava. This right here, this white structure, is the portal vein. So, and then this of course is the liver. If we can see this very faint line coming off from the spinal cord, that is a spinal nerve. Okay? Of course we have right here, and right here are ribs. Okay, let's move along over to this image. We'll be able to see a little bit of the colon. So, right here, we can see transverse colon. We can also see that splenic vein now, right in here. We can also see right in here, what is this? This is the cortex of the left kidney. And then if that's the cortex out here, we have the medulla of the left kidney, vertebra. Let's see if we can see this here, right in this area right here, this kind of irregular shaped thing. This is the right adrenal gland. And then final structure we'll be able to visualize here, the pancreas, right? The head of the pancreas situated right next to the stomach. Alright, traveling along. Right here, coming off from the aorta, we can see it coming off from the aorta right there. That is the hepatic artery. Okay? This structure here with contrast in it is the duodenum. It's the stomach, colon. Specifically, it's the splenic flexure of the colon. So here's the spleen. More clearly now we can see the body of the pancreas, all of these kind of feathery folds to it. This is the left kidney. Okay, right here. The celiac trunk. So this is the aorta. This right here is the inferior vena cava. Very nicely defined here we have the portal vein. So this then is the liver. Let's see, what else have we got? There is a vertebra. So if that's the vertebra, here is the spinal cord. This muscle here is the rectus abdominal muscle, so around it we can see fat. Okay. Okay, then right here, right behind the pancreas, we have the splenic vein. Okay, this right here, kind of feathery structure, is the pancreas. This right here is the superior mesenteric vein. So behind it here, we have the superior mesenteric artery. This stuff right here is the ileum or jejunum. It's difficult to tell the difference between them. They kind of all move together. This right here is the descending colon. left kidney, so this would be cortex of the left kidney, medulla of the left kidney. Right kidney. This right here, the duodenum. This right here is the aorta. This right here is the inferior vena cava. This right here, almost looks like a rattlesnake coil, is the transverse colon. This right here is the liver. And finally, this right here, very nicely defined, is the mesenteric vessels. So we can see it feeding into the transverse colon. Okay, again, all through here, these little fine lines. Mesenteric vessels. This is the jejunum, ileum, kind of all through here. Small bowel. Okay, let's look at some muscles real quick. So we have, this is the external oblique. So if that's the external, we have here the internal oblique, and then this one here is the transverse muscle. Okay, let's look right in here. This kind of ill-defined structure here is the left ureter. Okay. This is an inferior mesenteric artery right here. Okay. This is the aorta. This is the inferior vena cava. Right kidney. Okay. This ill-defined faint line here is fascia. This is the ascending colon. Okay. This here and here is the psoas muscle. So patient's right psoas muscle, left psoas muscle. Okay, over here we have the descending colon. These here on either side of the spine are the erector spinae muscles. So patient's left and right. And then final thing, this muscle here is the quadratus laborum muscle. Okay, these fine lines, white lines through here, are mesenteric vessels. All through here we have small bowel, so jejunum and ileum with some air in them. Right here we have the psoas muscle, so it's the patient's left psoas muscle. So this ill-defined structure right here, just anterior to the psoas muscle, is the patient's left ureter. Okay. Inferior vena cava. This is the ascending colon. This is a vertebra. All right. This muscle here is the rectus abdominis muscle. So we see the aorta has bifurcated, and so either side here we have common iliac arteries. Okay, let's move just a little bit more inferior. We can now see some of the pelvis here. So continuing along, we have the cecum. Right here we have the patient's left common iliac artery. So this would be the right common iliac artery. Along the pelvis we have the iliacus muscle. Right here, this kind of ill-defined structure here, is the left common iliac vein. So over here we have the right common iliac vein. Okay, right here we have the ilium. This is the erector spinae muscles. Okay, right here we have the descending colon. Alright, and then right here we have the gluteus muscles. Okay, these fine lines through here are mesenteric vessels. We have the patient's left external iliac artery, and this is the right external iliac artery. Then of the gluteus muscles we have the gluteus minimus muscle, the gluteus medius muscle, and this is the gluteus maximus muscle. This bony structure here is the sacrum. Right in here and in here, these are the internal iliac arteries. Very close by it is the right common iliac vein. Again, we can see kind of a faint fine line around here. This is fascia. This here and this here are the rectus abdominis muscles, and then this is the ilium of the pelvis. Moving along, so moving a little bit more inferior now, we can start to see, just a second here, this is the bladder. Okay, this back here, kind of fluid filled, is the sigmoid colon. Okay, this here is the piriformis muscle. Okay, this here with some contrast in it is the left external iliac artery, and then right close to it is the left external iliac vein. So let's look for this here then is the right external iliac artery, and right by it is the right external iliac vein. So continuing with the male pelvis, we have the bladder. This here is the left external iliac artery, and right here beside it is the left external iliac vein. This gray muscular structure here is the obturator internus muscle. And this being the male pelvis, we can actually see the seminal vesicles back here behind the bladder. Right here we have the rectum. This bony structure here is the coccyx. This bony structure here is the ischium. Right here and right here we have the femoral head. So this is the patient's left femoral head. This is right here, and right here are the pubis bones. out here with some contrast in it is the right external iliac artery. So right next to it we have the right external iliac vein. Alright, and okay, and this here is the rectus abdominal muscle, or rectus abdominis muscle. Okay, and let's move a little bit lower down. We can see a few more muscles here. So we have right in here, we have the quadriceps femoris muscle. Right in here we can see the patient's prostate gland. Right in here we have the iliopsoas muscle. This structure here is the sartorius muscle. So there's a whole lot of muscles surrounding and encasing this structure here. The femur, so the hip joint, patient's right hip. This is the femur. Let's look at this structure right here. On either side is the gluteus maximus muscle. And we can still see just a little bit of the gluteus minimus muscle here. And then right here we have the gluteus mediatus muscle extending around towards the anterior part of the joint. And let's see, last thing here, right here, we have the tensor fasciolatimus muscle. Tensor fasciolata muscle. Okay, continuing on with the male pelvis. We can visualize the penis here. These structures here are spermatic cords. Right in here we have the left femoral artery. And right next to it we have the left femoral vein. A lot of musculature throughout this area. So right here we have the obturator externus muscle. Right in this area we have the rectum, right femoral artery, and this is then the right femoral vein. So we have the bulb of the penis, and very faintly within there we can see the ureter, or the urethra, posterior urethra. Okay, right here and right here we have the pubis. Right here and right here we have the femur, so this is the patient's right femur. Right here, this is the abductor brevis muscle. Okay. Back here, again the gluteus maximus muscle. Right here, this is the iliopsoas muscle. This is the tensor fasciolata muscle. Right next to it, we have the vastus lateralis. And then on the other side here we have the rectus femoris. So as I mentioned, lots of muscular structure here. This right here is the sartorius muscle. And then on either side the ischium of the pelvis. Alright, let's look briefly at the female pelvis and we will be finished. Okay. So, this right here is the bladder. This air-filled structure here, air and barium-filled structure here is the sigmoid colon. This is the left common, actually, scratch that, the left external iliac artery. So right next to it we have the left external iliac vein. Then in terms of muscles, we have this here is the gluteus minimus muscle, gluteus meatus muscle. So this then is the gluteus maximus muscle. Okay, now unique to the female pelvis we have the left ovary. Okay, this then is the uterus with an IUD present. Hence the star artifact there. This is the ilium of the pelvis. We're at the level of the sacrum. This muscle here is the piriformis muscle. Behind the uterus we can see the rectum. And then over here next to the uterus is the patient's right ovary. This here is the iliacus muscle. So just anterior to it we have the right external iliac artery, and this is the right external iliac vein. Okay, up here on either side we have the rectus abdominis muscle. Okay, traveling along, and we can actually see that IUD here now on the scout image. This will be our final image for the day. We have again the bladder. This here is the left external iliac artery. And the left external iliac vein. We can see here the gluteus meatus muscle. Okay. And just kind of anterior to that musculature right here, we have the right external iliac artery, and the patient's right here is the left external iliac vein. Okay, very faintly right in here we can see the rectus abdominis muscle, the pubis. This here is the femoral head, so it's the patient's right femoral head. Right in here we can see the vagina. This tip right here is the coccyx. And then just inside the bones of the pelvis we have, this here is the obturator internus muscle. This right here is the iliopsoas muscle. Right here we have the sartorius muscle. Right here we have the tensor fasciae lata muscle. This bony structure here is the ischium. And finally, right in here, very faintly, let me see, right in here, yes, right there, is the quadriceps femoris rectus femoris muscle. All right, that's it. Thank you.